Barbie and Ken really represent intimacy and friendship, which really should be the starting point of any relationship.
That's my guest, Donna Rice, describing the positive impact of Barbie and Ken on our love lives. I'm your host, Mr. Divabetic. Thank you for tuning in. Tonight, my guests are the co-authors of Divabetic's new ebook, Sweet Romance, A Woman's Guide to Love and Intimacy with Diabetes. Donna Rice is a registered nurse and certified diabetes care and education specialist. Dr. Janice Rosler is a board-certified sex therapist, licensed marriage and family therapist, certified diabetes care and education specialist, and a registered dietitian. Stay tuned as we get in bed with Barbie and Ken to discuss sexual health issues and concerns for both men and women with diabetes.
Do people learn about the birds and the bees from dolls like Barbie? I think that the age starts much younger when individuals play with Barbie and Ken. For one example, in my family, my 3-year-old twin granddaughters have a big trunk filled with Barbies and Barbie clothes and all that. And their way of play has nothing to do with sex or intercourse or intimacy or any of the things that gradually we start to introduce our children to as far as sexual expression. And it's all about fun and brushing the hair and having playtime in terms of fantasy. So if we're looking to Barbie and Ken to learn sexual information, they're far better dolls that are that are physically and anatomically accurate, that sex therapists, for example, and even parents can use to help their children or help adults understand different parts of their body.
I have to agree with Janice because I know I had Barbie dolls and I never connotated it with any kind of like sexual action or whatever. It was really about fashion. It was about her hair and her clothes and just growing up. I mean, I think there was a whole different perspective. And then the other aspect too is the perception. A lot of people, especially older people, maybe have a different perspective of what sexuality is and intimacy and friendship. And I think it all plays a role. And you really need, like Janice said, to really understand your audience and where they're coming from.
It's interesting in today's world, right, Donna, to look at how like several schools are banning books about your anatomy and to think like this doll never had an anatomy and how that impacts just how we grow up and how we think about love and intimacy.
Even looking at the schools today and kind of like what their thoughts are on sexuality and how really they're bringing it down to kind of, second and third graders today. So I think, looking back, it really reflected the times. I mean, it wasn't talked about in the school and sexuality was kind of like hushed as well, right? So just looking at the contrast of where we are and where we've been and where we're going, I think the hype around Barbie and Ken today with some of the things that they're saying about them kind of like makes sense when you just think of the trajectory of where we were, 40, 50 years ago, talking about sexual health and sexuality versus where we are today and where we're going. And I think Barbie and Ken have been kind of caught in that kind of like time warp where, they were there, their friendship, there's intimacy, it's the fashion, it's everything that, from a play perspective, but not really from a sexual health or education perspective.
You and I, in a prior conversation, Janice, talked about how maybe not having genitalia could help certain people as well who may be non-binary or trans. So what were your thoughts on that?
Well, this is interesting. To prepare for this interview, what I decided to do, since I am on staff at the International Institute of Clinical Sexology, we have a listserv, and we have about 200, at least 200 sex therapists who are being trained, who are participate in the sex therapist pre and post training. And I decided to post that as a question on the listserv. What do you guys think about Barbie and Ken and the fact that they don't have any genitalia? And the comments were varied and so interesting. some of the comments, as you mentioned, came from sex therapists who said, what a great opportunity to take the binary piece out of it. Yes, we see that Barbie looks a certain way and Ken looks a certain way, but because there's no genitalia, a child can use their imagination and their own decision regarding the identity of these dolls and the gender expression of these dolls and connect to them in any way they want. And one other therapist said, one day I was Barbie and the other day I was Ken. And I loved that I could go back and forth and be whatever I wanted in my mind and experiment and play. So in terms of giving freedom to that type of fantasy and that type of experimentation and role play is actually a wonderful thing that the whole Barbie and Ken world offers.
Can Barbie and Ken still experience intimacy even if they can't have intercourse? Stay tuned.
I think intimacy is really kind of like the starting point. It's friendship, it's intimacy, it's sharing. And we know that there's a lot of different types of intimacy. And if you look at, the history of Barbie and Ken too, there was that strong bond and that friendship. So certainly they could be intimate and, have a good time, share different of life experiences and do different things together. And really that is forms of intimacy.
So in terms of what is intimacy? Intimacy is connection, and we know there's several types of intimacy, and that they're not all sexual. Sometimes it's doing things together, as Donna mentioned. It's having intellectual conversations. It's doing something spiritual like praying together. It could be doing sports together, walking together, riding bikes together. And it could be physical that's not necessarily sexual. It could be hugging, giving a quick kiss, holding hands. It could be non-physical, where you're saying affectionate things, how much you appreciate each other. There's so many different ways to connect to whoever you want for your intimate partner. And on another piece, we're getting very focused on what's between the legs of Barbie and Ken. But there are a lot of ways to have sexual, not just sexual expression, but sexual satisfaction. For example, if someone, we'll say, is paralyzed from the shoulders down, they can experience an orgasm because the body can, through stimulation of the face, through massage, through all different touch, the body, everything is wound up in the brain. And we know that people who are paralyzed can learn to enjoy orgasms and experience orgasms without having genitalia function the way we expect them to, and without relying on the genitals to work in a certain way.
Janice, I want to ask you a question because we are talking about people affected by living with and at risk of diabetes. And specifically, wanted to bring up the intimacy issue to then talk about men who might be suffering from erectile dysfunction and so when you put it in the context of what you just said about being paralyzed, is this intimacy available for someone with ED? Because obviously that would be something that maybe they would shy away from being wanting to be with their partner no matter what. And I could see relationships dissolving, or just the fact that they wouldn't even want to get involved with someone because of it.
It's interesting. There's something called tantric sex. And tantric sex, it has a lot to do with kind of suppressing, not suppressing, I should say, with waiting and building up sexual tension. And so what you do is you hold off on the erection, and you hold off on the ejaculation. And if you can't have an erection, that doesn't mean that you can't have an orgasm. It's possible. And also you can have an orgasm and not have an ejaculation. So there's a lot of different ways to approach sexuality. And the one thing that we forget is our bodies have so many sensual locations. A lot of people can get incredibly turned on when someone massages their ears or other parts of their body or their feet. And so if we just totally focused on vaginal penile areas of the body, we're missing a whole lot of other things that can give incredible stimulation. And also the orgasm doesn't have to be the end game. Just having sexual expression, sexual fun and pleasure in so many other ways. There's many, many layers of different ways to enjoy things. And to say, oh my gosh, if I don't have a firm erection and then an ejaculation, that it's been a failure. And it doesn't have to be the case. One thing we know about men with diabetes is that, first of all, their erection is very much related to or associated with their blood sugar control, ability to keep their blood sugar in a healthy range. The more that the blood sugar level goes too high, the likelier they're going to have trouble with erections. And also the opposite is possible. It happens as well, which is if they start to improve their blood sugar ability and where their blood sugar is throughout the day, then they are more likely to have healthier erections. And so that's a big piece. But there's so much to do in the entire global world of sexuality and intimacy that while they're healing, while they're working on themselves, they can still have wonderful, intimate and sexual interactions with their partners.
And Donna, how about women with diabetes? Because I want to ask you some of the more common health issues sexual health issues they might be dealing with, specifically, like if it's painful to have sex, they might not want to have intercourse. So is intimacy an option for them?
Yes, and I think one of the starting points, and I think Janice alluded to it, that we've always talked when we do education to both professionals and to patients, we really talk about really set aside the kind of the penis and the vagina, get away from that, really start focusing on what you love about that person and what really turns you on in the beginning, and to really try to get them back to those intimate moments so they could start really focusing on really what mattered and what really made them really attracted to that person. And then if they're having issues like related with women, related to like pain, sometimes it could be related to vaginal dryness, there's remedies that can help that. So I think really the bottom line is really helping them to focus away from kind of the sex act into what makes a difference. And if there's real issues related to the sex act, let's look and try to get some treatments or remedies that can help that as well. So I think you need to kind of do both of them together. But in many instances, especially with men, and if they're having trouble with erection, it's really, like Janice said, really getting them to really like focus on other ways of that where they're sensitive and where they really feel sexual and sensual as well.
Well, and also I want to mention, this doesn't mean give up and accept where you are and we're sorry, this is what you've got. That's not the case. There is a treatment for absolutely every person. And for men, for example, those are those who want to, who have penises and want to be active. We've got all the different medications that may work in some men, all those pills like Viagra. We also have a lot of different lubricants that can be helpful. There's injections. There's different types of things that they can use. The vacuum pump, and also they can take an implant, which brings incredible pleasure to have that because it works as naturally as possible. And even the partner won't even recognize that the person has something. So there's a lot of tools for the men. For women, we know primarily, we've got lubrication issues. There's vaginal pain that sometimes happens with women. There can be issues with orgasm. And we know that depression is often linked very closely to women who are struggling with their sexual response. And that's a big thing for women with diabetes as well, because depression is also linked very closely to diabetes. So with women, we can treat that. We also treat the relationship between the couple. There's so many different options and things to try. So I guess the big message for your audience is don't give up and don't think that you can't have a richer, more fulfilling, intimate, and sexual life.
Right. And I think another message is really ask for help. And if you don't feel like you're getting the answers from your provider, there's other providers that you can go to. So don't give up. And I think that's really the message. And I can't tell you how many times people would say to me, I am so glad we met you. I didn't know that there was even anything out there. I thought it was over. And they're just so relieved that there are options out there. But if you don't ask, oftentimes people, healthcare providers don't pose the question first. Sometimes you have to bring it up too.
Straight ahead, my guests and I discuss what to do if you and your partner don't see eye to eye in the bedroom. We're back with the co-authors of Sweet Romance, A Woman's Guide to Love and Intimacy with Diabetes, Dr. Janice and Donna. We're talking about, and this comes up in the book, those awkward times where you might feel embarrassed about discussing your desires specifically with the one you love. How do I begin that conversation? Like, what are some tools I could take away to feel less embarrassed?
Well, so first I want to tell your audience this one piece of information. There will always be in every relationship a low desire partner. That's someone who wants sex less often than the other. And it can switch. There may be times when one partner is a lot more interested in physicality and in sexual expression and intimate activity, and the other one might be focused on job deadlines or whatever and is less interested. It always happens. And even when you're both interested, one is going to be lower than the other. So for example, let's say that you want to make spaghetti for dinner tonight, and your partner had a different idea for what to eat, but goes, you know what, spaghetti sounds good. One of you is more excited about the spaghetti than the other. You can both enjoy it, but one of you will be a slight bit more enthusiastic. So there's always someone lower and higher. It's absolutely normal. I hate to use the word normal, but it falls into the realm of how everyone is. So if you're the one who feels less interested and feels that your partner is putting demands on you, or vice versa, you're the one who wants more and you're not getting enough enthusiasm from your other partner, this happens in all relationships. There's nothing broken with you. So that said, the suggestions that I would make, especially when diabetes is in the picture, and really for any couple, is to make an appointment for intimacy. The whole notion that it's spontaneous and you're going to run and pull your clothes off and all that, it may happen once in a while. It could happen on a vacation when you're both relaxed. It may have happened when you first got to know each other. But more often than not, our lives are busy, our focuses are in different places, and we need to make an appointment for intimacy. If you both know that you're going to take time out to be intimate Thursday night after the kids are put to bed or whatever, then you can start thinking toward that time. You can start deciding, you can start to wind down your efforts to do work. You can start to think of how you might want to enhance the evening. So making an appointment, which is actually a date, make a date for sex, that can be a really, really helpful thing. And then there's also a lot of tools talking about what you like, what you don't like. If talking about it is difficult, there's actually something I suggest couples do. You can each draw on a piece of paper the outline of like a gingerbread cookie, that gingerbread person, and then take a red, a green, and a yellow marker. And what you do is mark in red the areas where you absolutely do not want to be touched that particular evening or that time. Maybe your foot hurts. You don't want to be touched there. Maybe you just don't want your breasts to be fondled tonight. You're not in the mood. You can put red over there. Then yellow is where you are, you'd like to be asked first. So Perhaps if you want to do your buttocks yellow, you can say, that's a maybe. So ask me first. Or maybe even your genitals, ask first. Don't just go there, ask first. And then green is, you don't even have to ask me, you've got my permission. And that could be your hands. It could be your entire body if you're in the mood for it. Maybe it's your neck. Maybe some days you don't want your neck touched, but today you do, and you don't care. So that's green. So this is a visual permission board, sort of, where you can kind of color it in and say, here's where I am at this moment. And then you don't have to discuss it. You don't have to negotiate it. It's right there, and you can actually make a game out of it and go, whoop, I'm not touching there. That's red. And it may change as the time goes on. So that's also helpful for couples.
And Donna, I wanted to circle back to what you were saying about just my relationship with my provider. I mean, you have outreached and worked with so many different organizations, including Diabetes Sisters. How have you found the comfort level of the patient population in bringing up any of these topics?
Yeah, and I think, talking about sexual health or sexual problems is really, really difficult for everyone. And I think that's probably the question that I get all the time is, how do I do it? How do I say it? What do I do? I'm embarrassed and all that. And so I just think that really what you have to do is, and I tell everybody, write down your questions. And, today, healthcare providers are really busy. There's less of them, especially after COVID. Their appointments are short. Sometimes they don't have the time to speak. And if you have a lot of other issues going on with maybe chronic disease, hypoglycemia, or whatever, sometimes, sexual health takes a back seat. So I always tell everybody to say to the doctor or to the nurse practitioner or whoever they're seeing, I have some really important issues that I want to talk to you after we get through maybe talking about my diabetes management and some of those things, and or write them down and give them the questions. Today they have my chart and ways to communicate. You could send the questions ahead of time so that they're prepared as well. So I think that there's different things to do, but I think it takes encouragement, it takes some education and someone giving them that, the support to do that. Because I could say it is probably the number one question that I get, and I'm sure you do too, Janice, how difficult it is to bring up questions around your sexual health, especially if your A1C is 8 or 9 and you maybe have some other things going. That's an important part of your life too, but sometimes it just feels like you can't get it in.
Right. We have to remember that healthcare providers are human too. And as awkward, we think that they, hey, they should be able to talk about anything, but many of them are as uncomfortable as we are about talking about sex, which is truly a shame. But what that means is if you do bring it up to your healthcare provider and they don't seem comfortable, they don't seem to be giving you the responses that you were hoping to get, ask to speak to someone else, find someone else. See if you could, it's possible that one of the nursing staff is better to talk to. Or when I did a lot of my work early as a registered dietitian, I had a lot of patients bring it up with me, and we would talk about their sexual health, which, because they felt that I was approachable. So we all encourage everyone to get a dream team of healthcare providers and find the one who you feel is going to be most educated about this and most willing to have the discussion with you. And the most important thing is you deserve to have a meaningful sex life, whatever that looks like, meaningful intimacy in your life. And don't sign off and say, I can't get help for it, or there's nothing for me, and give it up. And also, if something doesn't work, then don't give up on that as well. There's a story that I have. This one gentleman went to his endocrinologist and was complaining about, erection problems, ED. And the endocrinologist said, you're a great candidate for Viagra. That's what was out at the time. And so he gave him a prescription. And he saw him later and said, well, so how's it working for you? You didn't say anything. And he goes, well, doc, it's not working at all. And he said, well, how come it's, you're a great candidate for it? And he said, well, what I do is I take the pill and then I sit and I read a book about growing tomatoes. And then, nothing happens. And the doctor said, you need to use it properly. You need to do something sensual, erotic to get the body going. The pill isn't robotic. It doesn't just give you an erection. So learning how to use it is one thing. So make sure that whatever you try, you learn how to use it properly. And then also the pills, the oral erectile pills that are available only work in about 60% of males with diabetes. So if you're one of those and you don't get a lot of satisfaction from it, or it worked for a while and is it working anymore, don't say, well, I guess that's the end of it for me. There are other options. Speak to your doctor again and let them know that it's not working for you and you want to try something else.
Yeah, and just to jump in here too, a lot of my patients were really unaware that urologists really deal with a lot of sexual health issues, and the implants and some of the other ones too. And there's a lot of sexual health clinics within urology practices, and I think that was kind of like an aha moment for so many of my patients, because they'd be going either to primary care or internal medicine, and yeah, maybe they could get the script. But if it didn't work, like Janice mentioned, it was that next stop. And thank goodness that physician was able to address it and ask what the efficacy was of that drug, and then help him through it so that he's successful. But oftentimes that doesn't happen. But I think just giving people information and knowing that there are other providers out there, that it's not the end of the line, that, like Janice mentioned, there are other treatment options. And oftentimes they may need to go to a different provider, can really help them expand some of those treatment options.
All right, when we come back, we're going to go to the Divabetic mailbag and ask the co-authors of Divabetic's new ebook, Sweet Romance, A Woman's Guide to Love and Intimacy, Donna Rice and Dr. Janice Rosler, to answer your most pressing questions. Stay tuned. Janice, I'm going to give you the first question because you kind of brought up this topic. Cigarettes and Viagra, do they go together or don't they go together? This is one of the hottest topics on the Divabetic blog.
Well, here's the thing about erections. To have a healthy erection, you need good blood flow and healthy blood pressure. You need to be able to get the blood. When the brain says go, you need to have the blood delivered to the penis and stay there so you can have a healthy erection. Cigarettes impact circulation. They wreak havoc with it. They cause problems with circulation. You've got the nicotine, all the effects of nicotine. And the thing is, it's fighting against the Viagra, because what is the Viagra doing? The Viagra is prompting muscle tissues to relax so more blood can flow more quickly. And the cigarettes are, who knows what they're doing. They're messing up your blood flow and your circulation. So do they go together? No. And what I really encourage people to do is try whatever you can do to stop smoking. We see such a big difference in individuals and their ability to have healthy erections. Even within a short period of time, once they stop smoking, their erection gets much healthier. And then many of them don't even need the Viagra at that point. So that would be my recommendation, is that they really don't go together.
All right. Okay, Donna, you're in the hot seat.
Okay.
Many people on our blog have a problem or anxiety about going to the bathroom in front or around their partners. What's your advice?
Well, I think, if you're uncomfortable, communicate it, say it, and then don't do it. So I do think it's really up to the individual and what they want. And I think people have to respect their needs. So I think my thought on it is, if I said to my partner, I really want privacy, I think it should be granted and respected.
Janice, what's your take on that? Because this has come up on the Divabetic blog a lot, where people even start to experience IBS because, they just feel so awkward getting out of bed and going into the bathroom about what could happen, that they just cause a lot of digestive stress on themselves.
It's so interesting. I really think that I agree with Donna. There's nothing wrong with privacy. I really don't think that this is a requirement to be able to use bathroom facilities in front of each other. I think that it's okay to close the door. I think it's okay to lock the door. I think, we have boundaries that we can put in our relationship. There are many women who prefer to dress privately, get dressed in a private area in their closet, and not have their partners see them. Yes, in bed they may be naked and during sexual times and during intimacy, but when they want to get dressed, they don't want anyone staring at them or looking at them, and that's not their thing. There are a lot of couples who do erect that boundary, and if that's the boundary that helps you feel comfortable, I see no problem with doing that. It's something that's negotiated within a couple. And then the question would be, what does that mean to share that type of activity together? And what does it mean to you that you aren't doing it? That to me would be interesting to look at. What does that say about you? What doesn't it say about you? How come you think that that's something that's so important? As I said, I don't think that if a couple wants to dress separately, go to the bathroom separately, lock the door during those types of personal moments, and it works for them, that's fine. It's absolutely fine. I think we need to be able to do what we feel comfortable with and set our own boundaries. I have no problem with that.
All right. And then the final one was, again, to you, Janice, about, can you use coconut oil or olive oil as a sexual lubricant?
Yes, you can. You absolutely can. You certainly want to have clean hands. Make sure that you're using, a clean product. But these are natural oils, and the body, it's fine in the body. There are special lubricants that are made for the vaginal anal area. I don't think those would be good for any type of anal play, because generally you want something that is thicker, and those tend to be very thin. Also, there are some silicone lubricants that you don't have to apply as often. They stand longer. They're much more slippery, and a lot of people get satisfaction with those. Those are not water-based. They're silicone. You just have to be really careful. Even with the oils you mentioned, about getting them on the sheets, because they stay on the sheets. They're hard to clean up.
Coming up in our final minutes, we're going to talk about how role-playing and playing with toys in the bedroom isn't just for kids. All right, back to Barbie and Ken, Dr. Janice and Donna. It's a toy, and I know from streaming and everything, it's becoming much more mainstream that people hear about sex toys and role-playing. Again, talking about some of the things you address in the new ebook, Sweet Romance, some people are uncomfortable and embarrassed about this, but how can role-playing and even sex toys impact your intimacy and sex with the partner? Jan, Dr. Please.
Oh, okay. So in my perspective, the bedroom is a playground for adults. Ideally, you want it to be a place that's fun and just where you can relax. You can be kids again. You can role play. You can do whatever you want, just like Barbie. You can be the astronaut, whatever you want. So bringing toys in can enliven your sexual experience. And also, if you have any type of difficulty, perhaps if the male partner, for instance, wants to do some type of sexual massage on his female partner, for example, and he's got neuropathy and his hands aren't working as well, having a toy brought in, a vibrator or something that she can use, can be great. And also, of course, if it's a same-sex partner too. So people can you want fun, joy, different experiences, different touches, different vibrations. There's a lot of fun toys out there, different colors, different makes, things that are for different uses. They're not expensive. Just make sure that you clean them thoroughly and that you don't put toys from the vaginal area into the anal area and then return it to the vaginal area. You don't want to mix the anal area bacteria with, introduce that into the vagina. You don't want to do that. With your fingers as well. Make sure your hands are clean and don't switch from the anal area into the vaginal area without being very, very clean. But I think toys can really liven a relationship that has kind of flattened out and gotten a little dull, perhaps, or just for fun. Why not?
And
I was just going to jump in to say too, and wearing my clinical hat, I've worked with a lot of women who had really trouble with neuropathies and having orgasms, and vibrators really help. So I think that from a clinical perspective, and Janice mentioned it too with neuropathy, even with men, with sensation, it really, really helps. So I'm a huge proponent of trying it, looking for them, buying them. And there's places where you could purchase them and they come delivered to your home in a brown bag, so nobody would know, like your mailman or your neighbor or whatever. If you live in an apartment building, it's pretty discreet. But I really think that it really does help to enhance orgasm, and it really, like Janice said, fun, brings you together, and like she said, it is a playground in your bedroom, and I think you should do everything that you can to really make that experience the best for the two of you.
This conversation, I'm thinking that just telling your partner you have diabetes tends to open the door for more conversations around love and intimacy, because you're opening yourself with the vulnerability of expressing a health condition. And it just seems to me like you've got a toe in the door now that you could begin maybe some of these other conversations we've been talking about. Janice, how do you feel about that?
It's interesting because I think one thing that people really fear in dating when they share that they have any type of chronic disease, and of course we're talking about diabetes today, they fear being rejected. And I interviewed a lot of different individuals about how they date. And one thing that many of them found incredibly successful was if they can have a positive attitude, that will communicate to their partner how to feel about it, or how they could, one option to how to feel about it. For example, I knew someone with diabetes. He wore an insulin pump and he started dating this woman. And he said he was so afraid to tell her about having diabetes because he thought she won't want to date him anymore. It's a mystery. Turns out she did not know much about diabetes at all. As a matter of fact, she knew really nothing about pumps, nothing about blood sugar, nothing about A1Cs, nothing at all. She wasn't in that world. And she said that the approach that he took, he decided to be relaxed and just tell her calmly, not freak out, and just give her messages of confidence. And then he even showed her his pump. He even checked his blood glucose on his finger in front of her and said, this is who I am. This is what I have. And she said his level of confidence in that and how he could take care of living with this really relieved any concern she had. And she goes, okay, I guess he knows what he's doing. I think he's great. And they ended up actually getting married later. But I think the attitude that you bring to the relationship, if you're comfortable, if you are calm about it, it's part of who you are. It goes in the bedroom with you also. It's just like color your eyes, your hair, and, communicate it that way. This is part of the package and see what happens. And if the person you're speaking to rejects you and they say, this is more than I can handle, I don't want to deal with this, then they weren't worthy of having a relationship with anyway. And that's really how I feel about it.
How do you think Barbie and Ken could help start a conversation about your sexual health?
I would like to suggest that you have Barbie and Ken go on a date. And here's the great thing about using Barbie and Ken. Barbie and Ken can have the conversation that you want to have. And just like we do with children with puppets, and we give them stuffed animals and say, this is going to be you and this is somebody else. And then they have the stuffed animals have the conversation. One of you can be Barbie, the other can be Ken. You can both be Barbies, whatever, but you have two dolls and have the conversation. And it could actually make it a lot of fun, bring out a lot of honest comments, because it's not you saying it, it's Barbie saying it. And it could really, really open up a lot of conversation because it's done using the assistance of Barbie and Ken.
With the release of the movie, there's so much hype and so much talk about Barbie and Ken. And I think really, truthfully, a lot of people really didn't really think of it from a sexual perspective. But I think from the intimacy side and the friendship side, I think it could bring a lot of dimensions to a kind of sexual health. Gender identity, you don't have to be male, you don't have to be female. You could be whatever you want to be. And I think the message here is, I could be whatever I want to be, male or female or whatever. And I think that certainly in today's sexual landscape and what's going on could be, I think, a real value, especially for young adults or adolescents, really learning about and really struggling with all of the things going on with sexual health.
I want to thank Donna Rice and Dr. Janice Rosler for joining me on this podcast. And thank you for tuning in. Special shout outs to our listeners in India, Australia, and Tanzania. Don't miss Divabetic's next podcast. Subscribe today on iTunes, Spotify, and Blog Talk Radio, or visit Divabetic's Facebook page and YouTube channels. Remember, every diva has an entourage, and I'm so glad to be part of yours. Let's get happy and stay healthy together.